Good morning. My name is Shannon Johnson, and I'll be doing a cardiac assessment for the University of Lafayette BSN nursing program. This is Caitlin. She agreed to be our to help me out with the assessment today. So we'll begin. I'll start by doing hand hygiene. Good morning, Caitlin. I'm Shannon. I'm going to be your nurse for today. How are you doing today?
I'm good. How are you?
I'm doing very well, thank you. Can you tell me your full name
Caitlin Melissa Johnson.
and your date of birth?
May 13th, 1993.
Okay. And do you know where you're at?
University Hospital.
Okay. So today the doctor asked us to do a cardiac assessment for you. So while we're doing this assessment, we're going to be observing Caitlin's skin to make sure that it's warm and dry. We're also going to be assessing for any pain or shortness of breath or difficulty breathing. Caitlin, are you experiencing any chest pain today?
No.
What about shortness of breath?
No.
Do you feel any difficulty breathing today?
No.
Okay, so Caitlin is not in any pain. She's not having any difficulty breathing. So we're going to just assess her skin by touching and palpating her skin to make sure it's warm and moist and dry. So Caitlin, do I have permission to touch you?
Mm-hmm.
Okay, so basically what we're doing is just going to be touching her skin. Her skin is warm and dry to the touch. Her color is appropriate for her ethnicity. Another thing with heart failure is capillary refills. So what we're going to do is just pinch her nail bed. It's going to blanch white and then release, and it's going to go back pink within 3 seconds. This lets us know that you have poor blood perfusion to your fingers or some type of oxygen deprivation, but your capillary refills are good. We're just going to assess all your nail beds. Also with the cardiac assessment, we're going to assess for clubbing, which is also common in patients that have COPD. So Caitlin, I'm just going to ask you to hold your fingers together like this. Okay, thank you. And we see the space in between there, so it's nice, round, and curvy. Can I get you to sit up?
Mm-hmm.
Also with the cardiac assessment, we're going to be assessing the her chest to make sure it's symmetrical and no barrel chest, which is also common in COPD patients and patients in heart failure, but her chest is symmetrical and straight. So thank you, Caitlin. You can go ahead and lay back. So we're going to start from the head and work our way down. We're going to assess her conjunctiva. So we're going to just pull down her eyelids, and it is pink and moist, which is also a sign of heart failure and one of the most important. So we always want to make sure we assess that. So we're going to come to the carotid and jugular vein, which is located right here. And what we're going to do is I'm going to ask Caitlin to turn her head to the side. We're going to also have her at a 45-degree angle for this assessment, and we're going to basically just palpate. And we're going to palpate in several different points to make sure that it's pounding, and hers is. Also, another important thing we have to assess for with the jugular vein is jugular vein distension. So what we do is use a pen light to assess for that, and we'll assess on both sides. And remember that we always feel the thrill and listen to the brewery. So we're going to take the stethoscope and we're going to listen with the bell of our stethoscope to hear the brewery. Turn your neck for me, please. And it's very palpable. Let's see. And as you notice, I did one side at a time to make sure I didn't disturb blood flow to her brain. So now we're going to take it and we're going to go to her, listen to her breath sounds. Usually what we do is we do this, put the stethoscope to bare skin, but just for privacy, we're going to do it over Caitlin's clothes. But Caitlin being a female, we also have to, breast tissue might get in the way. So the first thing we're going to do is assess the PMI, which is the mitral point, and we're going to palpate it to make sure we can feel it. And it is very palpable. So the 5 landmarks of the heart are the aortic, which is at the second, the right intercostal space. We have the pulmonic, which is at the second intercostal space on the left side. You can use the sternal border as your landmark. Then we have the Erb's point, which is at the third intercostal space on the left side. Then we have the tricuspid, that is on the fourth intercostal space on the left side. And of course, then again, we have the mitral, which is at the mid-clavicular line at the fifth intercostal space. So we're gonna take it and we're gonna listen with our stethoscope. So we're doing the aortic, which is at the right second intercostal space. The pulmonic, which is on the left at the second intercostal space. Erb's point, which is on the left third intercostal space. The tricuspid, which is at the left fourth intercostal space. And the mitral, which is also known as the PMI, which is at the fifth intercostal space of the mid-clavicular line. All Caitlin's breath sounds, heart sounds very palpable and normal, within normal limits. Caitlin, you did very well. This would be a conclusion of our assessment for today. Thank you so very much.